Hi everyone, my name is Kara Koda. I am a physical therapist and a silver ambassador with Plexus Worldwide. And today I want to talk about how Plexus can change your bathroom habits and why this is a good thing. I will talk about what is normal and the goal with taking Plexus supplements, as well as what to expect during the early phases of healing and what is not okay. This video is brought to you by an independent Plexus ambassador and not sponsored by Plexus Worldwide. These are my general guidelines that I provide to my customers when they first start taking these products. This is based upon my personal and professional experience and research, but I encourage you to reach out to your personal sponsor to help determine what is right for you, because everyone is different. And please do not confuse this with professional medical advice. Always seek out your doctor if you have any questions or concerns regarding what is safe and right for you. Now, as a mom and a health professional, talking about bowel movements is almost a dinner conversation. And it's a regular conversation that I have with all my customers and ambassadors when they first start taking these products, especially during the early phases, weeks and months of taking them. Because many people don't realize what is normal anymore, because so many of us have gut issues. And so many of us don't know what is expected or the desired effect with taking our Plexus supplements. So before I talk about what is normal in the bathroom, I want to remind everyone of the importance of drinking water. You should be drinking at minimum at least half your body weight in ounces of water every day. This does not include coffee or juice or soda. It has to be water. And if you're drinking coffee, or if you're exercising, or if you are a nursing mom, or it's an extra hot day, you should be increasing your water to even more than half your body weight, because we want our bodies well hydrated, because our Plexus products work best when our bodies are hydrated. So how do we determine if our bodies are well hydrated? Well, we look at our pee and our poop. So when we look at our urine, it should be a very light yellow, almost clear. It should not be dark, it should not be a medium yellow. If you're noticing that, that is a sign that you're not drinking enough water and that you're not well hydrated. So increase your water intake. The second is looking at our bowel movements. What is normal? We should be going 2 to 3 times a day. Not once a week, not once a day, but 2 to 3 times a day, because that's oftentimes how many times we're eating in a day, right? So now that we've established what is normal and what the goal is in our bathroom habits, let's talk about how Plexus can affect your pee. Now, some people notice when they first start drinking Slim that they have to pee more often. And the main reason for this is detox. Your body is trying to flush out all the extra toxins and glucose that has been holding on to, which requires more frequent trips to the bathroom. Now, this can seem inconvenient to many people to have to go more often, but this is a great sign that the products are working to help you feel better. And remember, it's only a temporary side effect. Your body will self-regulate back down to normal once it has flushed out all those extra toxins and glucose from your system. Next, let's talk about how Plexus affects your bowels. For many people that are used to going once a day to once a week, BioCleanse and drinking enough water is critical to helping reach that 2 to 3 bowel movements a day. I generally start my customers with 1 to 2 capsules of BioCleanse every day, and then slowly adding 1 capsule every few days until they reach that 2 to 3 bowel movement consistency. Because remember, with Plexus supplements, we're trying to declutter and clean out your body, like your house. So if your colon looks like a hoarder's house, you don't start right away in trying to clean out the closets because there's no room for them. You want to clear out the hallways first, and that is our bowels. We want to clear them out so that there's plenty of room to start working on cleaning out the closets and the basement in our house. And that's how Probio 5 works. Probio 5 works to break up and kill off the microbes that are in our bowels to help flush them out. However, if our colon is not cleared, it's just going to create constipation, which is going to cause those toxins to be reabsorbed back into our body, which is going to increase your detox symptoms, and it's going to slow your progress to better health. And often I remind my customers that when they start increasing their Probio 5, they oftentimes have to increase their BioCleanse as well, so that they remain at the 2 to 3 bowel movements a day. So now that we talked about how Plexus can change your bathroom habits, let me briefly talk about what a normal and good bowel movement looks like. So sorry for the visual, but I will be comparing poop to different consistencies of food. Our bowels should look like soft serve ice cream, not a hard lumpy sausage. And there should be little to no strain with eliminating. But however, similar to how some people notice increase in urination with first starting Plexus, our bowels, the consistency of your bowels are going to vary greatly during the first few weeks or months of taking Plexus. And the reason for that is there's going to be a variation between sticky, pasty bowels and loose shredded wheat bowels. That's going to occur when we first start taking Plexus. The reason for this is that many people are walking around with old dry bowels, old stuff that's sitting in their bowels, sitting in their colon that has been sitting there for months to even years. So for our body to flush out the old stuff, it needs extra water. So I want you to picture that in your house you have a clogged drain from there's sticky grime in there. How do you get rid of it? Well, you first pour Drano in there, let it kind of soak in there, and then you flush it down with lots of water to help push that the blockage through. So in our body, BioCleanse works like Drano, and all the water that you're drinking is working to flush things through the bowels, which is why you're going to have a varying consistency of bowels. You're going to have those loose bowels that are basically trying to flush out all the sticky bowels that are sitting in there to help remove them and eliminate them. But after we've cleared out our bowels, we want to reach that goal of having soft serve ice cream. But there will be a lot of variation at the beginning when you're starting your Plexus journey. However, what I do not want is straight watery bowels, and you should not be spending all day in the bathroom. That is not what we want, because that will leave you more dehydrated. So if that is occurring, that you're just having straight watery bowels or too loose bowels, then you want to cut back on your BioCleanse until you reach that 2 to 3 good bowel movements a day. But err on the side of loose versus the lumpy sausage. Also, please note that your bowels will be a little bit more watery or loose during the first 1 to 3 days of when you increase your BioCleanse, but your body will self-regulate back to that normal range of bowel movements if you stay at that new level of BioCleanse. Do not fluctuate back and forth with the number of BioCleanse that you take in a day because you're experiencing those varying bowel consistencies. Your body cannot self-regulate if you keep changing the number of BioCleanse that you take in a day. So thank you for sitting through a lot of potty talk. I hope I did not ruin your love of ice cream or cereal, and I hope this information provides clarity so that you know what is normal and expected when you start your Plexus journey. And I appreciate you tuning in. Please reach out to me or your sponsor if you have any further questions, and I will see you next time.